From my experience, I can tell you that a few days before the exams, most of the students, they feel lost. Many students used to come to me and they would say, मैम समझ में नहीं आ रहा, कहाँ से पढ़ाई शुरू करें, सिलेबस बहुत ज़्यादा है, कितना पढ़ना है, किस आंसर में, किस टाइप के क्वेश्चन में कितना लिखना है, डायग्राम बनाना है कि नहीं, अप्लाइड लिखना है कि नहीं. So all these questions they have been repeatedly asked from me, right? So this video is actually not only to tell you the important questions from the upper limb, this I have taken, the topic that I have taken is upper limb, but to also tell you how to study and also how to answer the different types of questions, right? Now first of all, let us begin with how to study, right? You cannot study your anatomy books like novels, right? आप ऐसे नहीं पढ़ सकते हो. What you have to do is look at the important questions, right? And then what do? You find their answers there, right? Now you're more focused, right? So you know exactly what you are looking for in your textbooks or in your notes, right? When you're more focused, the retention is also much better. You will be amazed by the result if you do this, right? So I have given you lots of questions here, but you go one by one, tick them, and you will feel very confident at the time of exams. Have patience. This video is a little long because this is the first video on important questions. So I had to explain things in little detail. But watch till the end because I'll also tell you a source where you can find answers to all these questions at one place. So the types of questions that are asked in either part completion exam or terminal exams or pre-professional or professional exams, they belong to the following categories. And these are long questions, short notes or describe briefly, enumerations, draw label diagrams where you just have to draw the diagram and label it. And then we have give anatomical basis of some clinical condition or embryological basis of some clinical condition, then clinical case study and MCQs. This video will not include clinical case study and MCQs. I will put a separate video for these type of questions. Let us begin with the long questions. Which type of long questions can be asked from upper limb? So the first thing is a very important topic, that is brachial plexus. The question can be in this form: describe the brachial plexus under the following headings. Nowadays we are giving this kind of structured questions, but earlier the question could have been describe the brachial plexus in detail. Even if that is asked, then also you are supposed to answer under these parts. That is how it is formed, then what are its parts and branches and applied aspect. When branches is written, then you don't have to write which structures are supplied by those branches. If it is written branches and distribution or structures supplied, only then you have to mention that. Regarding diagram, whenever there is a long question, you are supposed to draw suitable diagrams also. It is written on the top of the question paper also. So here one diagram can do for this, showing formation, parts, branches, everything. Then comes the applied aspect. Now here in applied aspect, what you can do is you can write about the lesions of the trunks and not of the nerves. They are not needed. So upper trunk and lower trunk lesions, which are like Erb's palsy and Klumpkek paralysis, that is needed. But lesion of median, radial, ulnar or long thoracic nerve, that need not be written. If you want to draw diagrams here along with this, then that also you can draw. Remember here, in case of structured question, all the parts may not have same marks. So be careful about that. For example, formation can have just 1 mark, parts can have 2 marks, branches can have 3 marks, and applied aspect can have 2 marks, or sometimes it can have 3 marks also. So depending upon the marks, then you should write your answer. Let us look at the second question now. So the second important topic is cubital fossa. So describe the cubital fossa under the following headings, or describe the cubital fossa in detail. It's one and the same thing. You have to write under these parts only. So where exactly it is located, what are the boundaries? When boundaries are written, you are not only supposed to write the 3 boundaries of the triangular cubital fossa, you also have to write about the roof and the floor when this is a long question. Then contents. Now contents you should not write haphazardly. You should start from one side. right? Like from medial to lateral, what are the contents? And then comes the applied aspect. About the diagram, here you have to draw diagrams. For boundaries and contents, there can be one diagram can be for the roof, one for the floor if you can draw that. Applied aspect, at least two things you have to mention. First is the median cubital vein is the vein of choice for venipuncture, and second is brachial artery is used for measuring blood pressure. So these two must be written in this question. Let us see the third question now. From the joints of upper limb, usually the question is on shoulder joint, and the question is in this form: describe the shoulder joint under the following headings. These headings, they remain same for any joint, right? All the headings may not be asked, only few of them could be asked, 3 or 4. But if there is any question on any joint, then you should remember, if it is asked describe the so and so joint in detail, then all these headings you must include. But if it is in structured form, then you have to take care that under which headings you have to mention your answer. So here you can see the first is type and obviously subtype. Like in this case, it would be synovial and ball and socket. Then the articular surfaces, then capsule and ligaments you have to describe briefly. Then if it is written relations, only then mention it. Some of the students, what they do, even if relations are not asked, they will draw the diagram of relations, they will describe them. You are just wasting your time. You won't get marks for that. Next is movements and muscles producing them, right? Sometimes it could be written as just movements. Now, when it is a long question, then you must mention the muscle which are responsible for those movements in your answer, because usually you'll find that this part is of 2 or 3 marks. So you just cannot write abduction, adduction and finish it at that, right? So muscles which are responsible for producing movements, that has to be written in case this is a long question. Then about the applied aspect, only write if it is asked, right? So in this case, you can write about dislocation of the shoulder joint, frozen shoulder and so on. 2-3 applied aspects you can mention, right? Now diagram here, depending upon what has been asked, according to that you can draw the diagram. You can draw about the articular surfaces with capsule and ligaments, and then if relations are asked, then you can draw a diagram of relations. Here in applied aspect, you can draw a diagram of dislocation and show the structures which may get affected by it. Let us look at the fourth question now. So that will be on the nerves from the upper limb, right? So long question is usually on 3 important nerves of the upper limb, and these are ulnar, radial and medial. Axillary and musculocutaneous nerves, these are not usually asked in long question. Short notes can be there on these 2 nerves. So whenever you have to answer any nerve, it has to be under these headings, right? So the headings are origin, like in this case, from which cord they are taking origin. Then their root value that you have to mention. Then course. When you describe the course, most of the students write sentences after sentences. Instead of that, saving time, because you have a limited time, what you can do is practice making flow charts, right? So that makes life easy for you as well as for examiner. Then distribution, or it could be structures supplied, that is same. Now this you should mention under 3 headings, and these are the motor supply. That means the muscle supplied by these nerves. Second is cutaneous innervation or sensory supply. That means the skin area which is supplied by that particular nerve. And third is the articular supply. That is the joint which is supplied by these nerves. And finally, we have the applied anatomy. If it is asked, right, then you have to write about that also. Now here also you must write about the applied anatomy, the lesions of these nerves, right? For example, sorry, if radial nerve is asked, right? So in that, what you have to do is you have to mention there are 2 sites, right? Common sites where the injury can occur. One is in axilla and another is mid shaft of humerus at the level of spiral groove, right? So now this will make the signs and symptoms, right? They will be different. So mention these 2 sites and mention what will be the difference if the lesion occurs at axilla or at the spiral groove level, and that is at the shaft of this. Similarly for ulnar, the lesion can be either at the level of medial epicondyle or at the wrist, right? And in median nerve also, the carpal tunnel syndrome you should mention here in this case, right? Or injury can be if there is fracture of the lower part of the humerus, right? So that's how you must mention in applied anatomy the lesions you have to mention. So site, cause, that cause, what is the cause, then the site where the lesion can occur, and then what will be the effect of those lesions. Motor loss, what will be the motor loss, what will be the sensory loss, and what will be the position of either the upper limb of the hand or whatever it is, right? So that should be mentioned in the applied anatomy. Now we come to enumerations. Short note. Coming to short notes, I have mentioned here 16 topics from upper limb for short notes. Now when you have to answer short notes or a question which says describe briefly, yes, write to the point whatever has been asked, and yes, you have to draw a diagram or 2 diagrams, whatever is necessary. Plus you do have to mention 1 or 2 points of applied anatomy also, right? So let us look at the topics. First is the lymphatic drainage of mammary gland, which is very important. Then next is rotator cuff or musculotendinous cuff muscles, right? So here you have to mention those 4 muscles, their origin, insertion, action, right? And how they support the shoulder joint, where they do not support, that will come in applied anatomy. Or about the supraspinatus, its applied anatomy can be written, right? So action of these muscles, that you have to write, right? So next is abduction at shoulder joint. This is also often asked because this is a complex movement, right? So there are many muscles which are involved in that. Which muscle initiates it? Then next for till 90 degree, which muscle is there? Then for overhead abduction, which muscles are involved, right? And if any of these muscles get paralyzed, then what will happen? That will come in its applied anatomy. Cubital fossa can come as a short note or it can come as a long question also, right? But here you have to write very briefly about it. Now carpal tunnel, only carpal tunnel can be asked, carpal tunnel syndrome. If it is written carpal tunnel, just mention, not in detail carpal tunnel, but what happens if median nerve gets compressed, the motor and the sensory symptoms, that can be written along with the carpal tunnel. Obviously you have to draw the diagrams also here. Then anatomical snuff box, this is another topic which may be asked. Then there is a question on supination and pronation of forearm, right? So this could be asked as radio-ulnar joints also, right? So but there supination, pronation you have to mention, but you also have to mention that in case radio-ulnar joints is asked, then you have to mention the type and subtype of the joints also, and the ligaments which are there, right? That also about the joints. But if it is asked only supination and pronation, then you just have to mention on which joints it occurs and which muscles are producing them. Then mid-palmar spaces, this is another important topic which can come as a short note. Next is movements at first carpometacarpal joint, right? Because this is a multi-axial joints, right? So you write about which movements are possible and which muscles are producing them. Elbow joint can be asked. Then I said, as I think this is repetition, so radio-ulnar joints can be asked. Pronation and supination I have put earlier also. Then muscles, which important muscles can be asked? Deltoid is one of them. Serratus anterior is one of them. Lumbricals, they have very important role. So these muscles can be asked. Draws suitable diagrams, and in case of muscles you have to write origin, insertion, action, nerve supply, and applied anatomy also if the nerve supplying them that gets injured, right? So that also has to be written. As I told you earlier, axillary nerve and musculocutaneous nerve, long questions are not there, they are asked as short notes. In some universities or medical colleges, one question is asked, draw label diagram, right? So these are the common topics on which the diagrams are asked, and these are draw label diagram of brachial plexus, anastomosis around scapula, anastomosis around elbow, right? These two can also come as short notes, right? Then draw label diagram of boundaries and contents of cubital fossa. Again, remember here when boundaries are asked, and if it is for 3 or 4 marks, you're also supposed to draw the roof and the floor also. Then boundaries and contents of axilla, right? Then we have cutaneous innervation of hand, right? When it is written hand, then be careful. If it is written hand, that means it has to be on the palmar aspect also as well as on the dorsal aspect. Otherwise it will be written as cutaneous innervation or sensory nerve supply of palm, right, or dorsum of the hand. If it is written hand, then it has to be both the sides, right? So this is draw label diagram, and next comes the enumeration. Coming to enumeration, I have put 20 most important topics from which the questions can be asked, right? So when you are writing answer to enumerate question, right, you just have to mention the names of those structures. There's no need to draw diagram or to explain anything, right? So let's see here: structures piercing clavipectoral fascia, contents of axilla, branches of any of the cords can be asked, right? So you just mention lateral cord, the 3 branches, that's all you have to mention their names. No diagram, nothing else. Then comes branches of third part of axillary artery. Usually third part is asked because first part has got only 1 branch and second has got 2, right? Then comes muscles forming musculotendinous cuff. This will be asked along with their nerve supply. Then muscles of flexor compartment of arm and their nerve supply, or the question can be name the muscles which are supplied by musculocutaneous nerve, right? Usually posterior compartment is not asked because there is one big muscle, that is triceps there. Now muscles attached to the medial border of scapula. One has to be very careful, right? Why it is asked? Because you have to mention all the 4 muscles, the 3 muscles on the dorsal surface of the medial border and one that is serratus anterior on the ventral surface of the medial border. So all the 4 muscles, they need to be mentioned. Other enumeration topics are okay, structures attached to coracoid process of scapula. This is often asked. Muscles, you have to mention here both the things, right? The muscles, the 3 muscles as well as the 3 ligaments also. Or the question would be muscles attached to coracoid process or ligaments attached to coracoid process. So read the question carefully. Then muscles responsible for abduction at shoulder joint. I have told you, right? So that you have to mention all the muscles. Just name the muscles, right? Here you don't have to describe it. You can write supraspinatus is there, then deltoid is there, serratus anterior, trapezius is there. You need not write anything in detail. Contents of cubital fossa, right? Again from medial to lateral side, the 4 contents you have to mention. Muscles supplied by median nerve in the forearm, right? 6.5 muscles. Muscles supplied by ulnar nerve in the forearm, 1.5 muscle. Then muscles responsible for pronation and supination along with their nerve supply. Structures passing superficial to flexor retinaculum. Again, see here, it is written lateral to medial. If you write medial to lateral or you write haphazardly, you lose marks, right? So read the question properly. Structures passing through carpal tunnel or deep to flexor retinaculum. Structures passing deep to extensor retinaculum, again read here from lateral to medial side. All the 6 compartments you have to mention from lateral to medial side and the structures passing through them. Muscles supplied by median nerve in the hand, the 5 muscles, 3 of thenar eminence, the first and second lumbrical you have to mention. Muscles supplied by ulnar nerve in the hand, the 15 muscles, you have to name them, right? Next we come to anatomical basis of certain clinical. For anatomical basis, I have put 12 conditions here. So first you can see here is Erb's paralysis, second is Klumpkek's paralysis, right? Now what happens, students will just write the signs and symptoms of these conditions and they expect marks. No, that is not the anatomical basis. Anatomical basis means which trunk was involved in these cases of brachial plexus, what was the site of injury, what was the cause, and then you write about the signs and symptoms, right? So the most important thing to mention here is what happens to the anatomical structure there because of which these conditions are produced. Then winging of scapula, right? You have to mention either the long thoracic nerve that is injured, where it can be injured, then which muscle will be paralyzed, like serratus anterior will be paralyzed, and then write about how the winging of scapula that appears. Wrist drop, the same thing, again nerve injury. Then claw hand. In claw hand, if it is written claw hand, then you have to mention both partial claw hand, that is ulnar claw hand, and complete claw hand. Here you have to mention then the injury at the lower trunk, that is Klumpkek's also, as well as If there is injury at the wrist and both median as well as ulnar nerve are injured, then that also leads to complete claw hand. So you have to mention both complete claw hand as well as the partial or ulnar claw hand. Then carpal tunnel syndrome, you have to mention the injury occurs within the carpal tunnel, which nerve is involved, median nerve, and then later on you explain the signs and symptoms of that. Student's elbow, similarly, where exactly the injury is at the lower end of the humerus. Tennis elbow also, which condyle is involved. Then we have the median cubital vein, why it is the choice of venipuncture, right? Then mammary gland abscess should be drained by radial incision. What is the reason, anatomical basis for that? Infection of pulp spaces of digits may cause necrosis of distal 4/5 of the terminal phalanx. What is the anatomical basis of this? Infection of thumb and little finger are more dangerous than those of the fingers. Remember the radial and the ulnar bursa, right? So that's how you can find out. Now, where to look for the answers for this? I have a website, and there you can get the answers of all these questions. And I think, yes, this is the screenshot of one page of my website, right? So you can see here, these are the enumerate questions. You just have to click on this and you will be taken to the page, right? Relevant page, and you can find the answer there. I think next screenshot you can see here. Okay, you can see the name of the site here, anatomyqa.com, that can be seen here. And here the questions, the same one which I have mentioned here, they are there. Write short notes on, right? So suppose here is lymphatic drainage of mammary gland and it is written click here. So if you are going to click here, you will be taken to the page of the mammary gland, and this is the screenshot of that. And here you can see the lymphatic drainage of the mammary gland explained in detail, right, which you can write as an answer. So you can visit this site. I'll put the link of this site in the description box also, and it is free. It is no money has to be paid, right? So feel free to visit this site. Thank you so much, and if you have not subscribed my channel, please subscribe it so that I can put more such videos. And please write in comments what else you expect, what kind of videos you would want, right? Any suggestions to improve, they are most welcome. All your comments are most welcome. Thank you again for listening.